Hi everybody, it's the show here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here at this channel, we discuss all things pregnancy, birth, and wound health related. So if you guys like the content and you like what you hear, please be sure to subscribe to the channel. Today's topic is going to be about teratogens. And I want to just quickly show you a flashcard. Let's get it focused. This is the word, just in case anyone wants to look up the word, get more information about it, and learn how to avoid these things called teratogens. So teratogens is, or they are, a substance or chemical that causes birth defects. And these substances we want to think about in a broad term. So we want to think about what we're eating, what we're using, what we're putting on our skin, what we're cleaning our homes with, um, all of that stuff, So when we're thinking about teratogens, I'm just going to go over a whole list of what can be classified as a teratogen. It's a lot of them, but I'm going to go over all of the ones that I can personally think of. So we're going to start with alcohol, obviously. We're going to start with smoking, cigarettes, any tobacco products, any vaping, all of that stuff is classified as a teratogen. Raw undercooked foods, that's going to be sushi, runny eggs, all of that kind of stuff is classified as a substance that can cause birth defects. Now we have caffeine, coffee, teas with caffeine in it. They are, first of all, I always talk about how detrimental coffee is to the body in general. This is for women and men. Coffee is completely detrimental to the brain. It dehydrates you. It can cause so many problems. It's a womb destroyer. So I do not advocate for any kind of coffee, any kind of caffeine, chocolates, all of that stuff. So caffeine is very high on the list for teratogens. Any kind of drug, substance, narcotics, any kind of, drugs, street drugs, they're all considered teratogens, obviously. Do you have things like aspirin, which is a huge one because I'm starting to see now that a lot of us pregnant women are being prescribed aspirin. So please keep that in mind. Antihistamines are a teratogen. Hair dye, have to be careful. These are chemicals that cause birth defects. They are mutagenic. They can increase rapid cell production, which can cause so many different issues. We have things like makeup, which is a huge one too, because a lot of us women are wearing makeup every single day for long periods of time. And I want to discuss too, which I should have did at the beginning of the video, but these teratogens can impact us, and it can impact us anytime, but in our babies anytime. But the most susceptible time is between 2 months prior to your pregnancy and the 4 months going into your pregnancy. We are definitely most vulnerable to these substances. So back to the list of things, you have epinephrine, which is the adrenaline shots. You have the cleaning products that we're using. A lot of these popular cleaning products that we're using, they are very high in chemical fumes, paint thinners, all of that stuff are teratogens. I'm trying to think if I missed any off the top of my head. Steroids, that's another one. It's a big, we have so many people taking medicine for asthma. We have so many people taking steroids for so many different reasons. Now, the reason why we're talking about teratogens and the reason why we are going over this large list of substances and things that can cause birth defects is because these are things that are often in our daily practices, and we're using them throughout our lives in throughout our pregnancies, and we don't even understand and know that we are using it. Pesticides are all of our food is sprayed with pesticides, and then we go home with our groceries and we just throw them in water. We think that they're clean. That doesn't work that way. We have to effectively and efficiently clean our foods so that we are not collecting those substances in our bodies. So teratogens cause so many different types of birth defects. You can go from things as cleft lip. You can go from tongue ties, extra finger digits, um, underdeveloped lungs. So all of these things come from our cells overproducing or underproducing. It comes from the mutagenic effects of teratogens, and we are left with children who have so many different complications, heart murmurs, so many different things like that, and we're like, oh, it's hereditary, or oh, you know, it just happened, or it naturally happened, and it's like, no, your baby is supposed to be perfect. They are supposed to be perfect. They come and you form a baby in a healthy body in a healthy way. So when we're speaking about what we can do to optimize our experience, our children's health, this is why I speak out about these things, these substances that we can avoid, especially, I always say every pregnancy isn't planned. Everybody doesn't know, oh, I want to have a baby, or I'm pregnant. You can find out at 2-3 months. So I get that and I understand that. So that's why as soon as then these substances should be avoided. In general, my general belief is that these substances should be avoided anyway, because teratogens could also affect us, childbearing women in different ways. It might not cause a birth defect because we're already alive, but it causes other things. It causes disruption in our hormones. It causes endocrine problems. It causes so many other things in our bodies as well. So I always advocate for a more natural approach to your lifestyle, more healthier way of living. So, and this is just information. I'm just putting this out there because I know it's not common knowledge. Some people may think it is because they may know it, but it's not common knowledge for most people. Most people go their day-to-day lives using products, eating things, bleach, chlorine, all those different things, thinking that it's the right thing to do, and it's going to help them, disinfect their homes and do all of it. And they don't know the other options and the alternatives that are safer and healthier that can do the same job. So this is why I'm speaking out about the day-to-day things that we are using that can cause harm to our children and even to our own bodies. So just keep that in mind. Again, I always advocate for us to research, dig a little deeper, use your intuition, use your instincts, but definitely know, what you're doing. You know better, you do better. So that's my take on birth defects and teratogens when it pertains to our beautiful little ones. And I always appreciate everybody to coming in and tuning in. So I thank you guys. I will see you for the next video. Peace and pregnancy deaths.